Texas has one of the worst nursing home records in the country when it comes to quality of care. A partnership between counties and nursing homes promised to use tens of millions of taxpayers' dollars to change that. But has the money been spent as it was intended? WFA's Charlotte Huffman investigates.
Hope she's proud of me, and I definitely miss her. Kind of have a conversation with her every now and then.
Sometimes the death of a loved one can light a fire under you.
Come over and kiss her sometimes.
To try to spark change.
I want to see, the elderly be treated fairly.
That's the case with Monica Lewis and Judy Edwards. Once strangers, the two are now friends, united by the same feeling of,
I would say, pain.
They met back in 2015 at this nursing home, the Duncanville Healthcare and Rehab Center. Both of their mothers were living there, and both of them were unsatisfied with the quality of care.
So it was just one episode after another.
But this story isn't about the way their moms died. Both women knew that was inevitable. In 2015, the Fed started a new program. It offered nursing homes more money for Medicaid reimbursements, in some cases, millions more per year. But the nursing homes had to be government-owned.
They said, look, we're going to help provide more funds to the facilities so that they can provide better care.
Attorney J.T. Bora has followed the program closely since it began.
The whole purpose of the program was to increase the quality of care.
Since the nursing homes had to be government-owned to get the extra money, their owners sought partnerships with county hospitals like Parkland.
What the program will do is it will bring additional resources to the nursing facilities as well. So part of that has to deal with staffing ratios.
The county and the nursing home struck a deal. The nursing home owners would keep managing their facilities, but on paper, the county would technically own them. That way, the extra federal money would start rolling in.
When we heard of the news, we were overly excited because we thought help is on the way.
Judy and Monica's mother's facility was one of the first the county took over under the new program.
We thought new staff, better equipment.
Since the program started in 2015, the county has taken over 29 nursing homes. That makes Dallas County the 5th largest nursing home chain in the state.
What's in it for the county and its taxpayers?
We get a portion of that money, which goes to the bottom line of the hospital. We're not a for-profit model hospital. We're a taxpayer-subsidized charity care hospital.
This fiscal year, Judge Jenkins says Parkland Hospital is projected to receive $5.9 million. He says that money is reinvested into services for indigent patients. Across Texas, many counties have followed Dallas County's lead, snatching up once private nursing homes. Watch this. In the year before the program began, roughly 50 nursing homes were owned by government entities like counties. Today, that number has grown to more than 450. That's an 800% increase in just 4 years. Remember, the sole purpose of pumping more money into those nursing homes was to help them increase the quality of patient care.
I mean, it's sad.
Bora says that hasn't happened.
Put it this way, it doesn't appear as if the results that they expected are actually happening.
Margie Sullivan agrees.
I have not seen any improvement yet.
She's spent 25 years as an advocate inside Texas nursing homes.
I don't know where the money's going. Maybe they're buying new furniture with it so the front will look pretty when new residents come in. Maybe they're buying a bread machine to make the nursing home smell better when you walk in the front door.
And here's what we've seen. Most facilities have not improved. That's according to federal nursing home data. The overall star ratings have either gone down or remained the same for 20 of the 29 facilities now owned by Dallas County. What's worse, despite an increase in millions in federal funding meant for patient care, records indicate more than half of the nursing homes have cut staff.
What do you do when you're one staff member responsible for 25 people and 7 people have to go to the bathroom at once at 3 o'clock in the morning?
Well, you might end up with a situation similar to what Judy captured on camera.
Mama, you peed on this pillow, girl.
The what? You see the pee coming out there? You see that?
Oh my God.
That's exactly why nursing homes are graded on how appropriately staffed each facility is. Out of a total of 5 stars, look at where the Dallas County facilities stand. Most have a 1 star. That's an F rating for staffing.
It just doesn't make sense at all. Where is the money going?
Good question. Administrators at Monica and Judy's mom's nursing home, though, declined to be interviewed about that. In an email, their attorney said the funds are used for the nursing home operations. He disputes the accuracy of the star rating system and defends the nursing home's quality of care. Crestview Court in Cedar Hill once had 5 stars for staffing. It now has a 1 star. In an email, administrators there say they are recruiting additional registered nurses and aggressively working to get their numbers back up. Meanwhile, the Office of Inspector General has launched its own investigation into the program in Texas. Investigators are concerned about whether the money is being spent as intended. Judge Jenkins, though, isn't worried.
They've already been to Parkland based on the interactions there. I'm not concerned that we'll have a bad outcome, but the report hadn't been released. I shouldn't comment further.
They're being paid to provide a certain level of care, a certain number of nurses, a certain number of aides, and they're just refusing to do it, and they're pocketing that money.
We can't say where the money is going, but if you ask these women, they feel strongly that where there's smoke, there's fire.
In addition to the federal investigation that's already underway, state regulators tell us at the end of this fiscal year, they too plan to review the program. Charlotte Huffman, Channel 8 News.